Hey everybody, just a couple days ago it was snowing and we're going through techniques and biomechanics for proper snow shoveling so you don't get a back injury while we're doing that. And I alluded to going through some deeper conversations on why we need to do some counteractive back bends after we've done some forward bends. That's what today's topic is going to be about. Why do we need to counteract and what's the mechanism behind that? And it applies to all of our daily lives. Dan's got a little model here that we can go through, and it particularly refers to the disc model, right? So when we're talking about disc model of care, what does that mean? Like, so when let's say that I were to do some forward bends, let's say I was gardening and I was pulling weeds for 30 minutes, and then when I stood back up, it was, oh man, I felt really stiff. What mechanism is happening there? How does that happen?
Well, usually what we explain to the patients is that the disc is very much like, in most simple terms, like a jelly donut. If we're squishing down one side of that jelly donut on a consistent basis, the jelly's going to have to go somewhere. There's the compressive forces over time will start to break down the back walls of the disc. Eventually this thing will start to bulge out so we can get the disc bulge, we can get the herniations and the big gun, the sciatica.
Yeah, or disc, the herniation, like where the sciatica, where something is pressing on a nerve. And I guess the big takeaway is that there's something within a disc that moves, right? It's changeable. And so there's more of a liquid portion of the disc, and there's a solid portion of the disc. There's a solid ring that contains the liquid. And remember, liquid moves depending on where you push it. It flows away from pressure.
Right, so just to clarify though, it's not really quite a liquid. It's about the consistency of crab meat.
Yeah.
So it doesn't move very far very quickly. So these things tend not to happen rapidly. It tends to occur over a period of time. And people will usually believe that it was just one incident that brought on the symptoms. However, it's usually a series of incidences over time that create this problem.
Exactly. So let's go back to the gardening example where I spent 30 minutes weeding and then I stand back up. Then the mechanism behind that theoretically then is that what's happening?
The pressure in the front of that disc is starting to push that fluid towards the back area. Now when we're younger, we won't necessarily feel that stiffness when we come back up, but over time we may start to notice it as we go to get up, or ooh, it's really, really stiff. We call it getting up like an old person, kind of like myself. Yeah, I do get that periodically. If
you would have been sitting properly, though, you probably wouldn't experience that in the first place.
I didn't have it right now. I was.
Either way. So I guess is that as you bend forward and you put pressure on the front of the disc, then the crab meat part moves backward and starts to want to stay there.
Right, over time.
Over time, all
and
right.
So as you start to come up and those joints start to close back down here, there's something blocking that ability to move. Now people, a lot of times, at least the people I've seen, they have the biggest excuses, I guess you could call it, when they feel stiff is that I've worked too hard, I sat too long, the weather's changing.
Sore muscles.
I have arthritis. But anytime we see somebody with that, we can prove to them and show them that if you move the particular direction opposite to that, you can restore that motion quite rapidly.
Absolutely. So again, back to the example again. I just bent forward. I feel stiff when I come back up, which means that I got some of that disc on the back side.
Blocking the ability to
kind of like trying
down.
to close my mouth with my tongue sticking out. There's something literally in the way. So what do I do about it?
Start moving the other way.
Very good. So when should I do it? Should I do it like before, during, after, all of the above?
For myself, the reason why I do what I do is because I had back pain when I was 14, and it was just a progressive problem. It seemed to be getting worse over time, and I figured I got to figure out, do something, because all I would get is pain medications, muscle relaxers, and there was no way to, I just kind of dealt with it. But as I learned what I know now, I started to figure out that if I checked my motion before I started doing like shoveling, check my back bend and my side to side movements, then I'd shovel for a little bit and then I'd check it again. And if I start noticing that my ability to go backwards or go side to side was starting to get less and less and less, then I would start doing particular exercise for my particular issue.
Mm-hmm. Yeah.
Right.
Let's take for example just this hypothetical issue of me or somebody that's weeding in the garden, and they don't really have any problems per se. They don't have any pain. They don't have any pain in their leg. They don't have any pain in their back even really. Let's just say that they get stiff whenever they bend forward, and then for a sustained period of time, and they try to rise back up, and they're like, oh, it's really stiff, and maybe they're walking a little bit forward bent for a while, and then after a few steps they straighten out. So the most effective means of preventing that, what would be like a preventative type of measure? Do some back bends like before, during, and after?
If somebody came in and told me that, I would probably say do some back bends before, do some during, and then recheck afterwards to make sure you haven't lost your ability to move again.
Okay. So is there a timing that's usually associated with that? Like, are there minutes, like do them every 5 minutes or do them every hour, or should you test?
It depends on the patient. It depends on the person.
Okay. All right. So it's customized. It depends on the individual.
If I sit on the floor and play with the cats,
Yeah.
5 minutes, and I'm already starting to feel that stiffness.
So for you, that's about your timing.
I
Okay.
can feel it, right?
Yeah.
So after you get used to doing these things, you'll start to feel that. Oh man, that's getting tight, and then you can get up and take care of it right away. And doing a preventative care like that over time will actually help you prevent major issues down the road.
Absolutely.
As a rule.
Yeah. Did you want to show the model just as a little?
We have this little simple
example.
model here. I'll have to get a little bit closer.
So let's set up. So this is the front side of the
disc. The little orange thing in here is like your spinal cord. And the red here is what's called the disc. And this is just an example we use with our folks here, showing that if you bend forward over time, what can happen is that will start to move out. It can actually occlude the space where this nerve is coming out. Now, until you get to that point, you probably will just feel stiffness and some back pain on one side or the other or across. But once you start getting far enough back and you start getting some pressure onto that nerve root, then you can start feeling it move down that leg and below your knee.
And by no means is this is not actually what happens. This is a huge, just diagrammatic example of the dynamics of the disc actually. Yeah, what we're talking about, the stiffness, that's not happening. This is strictly just to explain to you that the disc can change depending on how you move, and that's just a simple example of it. And if it gets, I guess the real world example of something like this, that would be a massive disc herniation and not just stiffness.
Right.
Yeah. All right, very good. So if we go back to the shoveling example, that's why we do a little back bending before we start. Then we do some shoveling with proper biomechanics, proper technique, do some back bends during, and do some back bends after. And like Dan was saying, let your body be your guide, and stiffness will let you know if you're doing it right or wrong, or if you're doing enough. Hopefully this has been helpful. The goal of all this is to add a little value to your life and hopefully prevent you from coming to see us. Thanks, and we'll be talking to you soon.